While we're getting the other bits of technology working, I'll get started to, I guess, introduce ourselves and what we're going to talk about today. So, thank you. So we're all part of an organisation called Queenslanders with Disability Network, and I'll hand over to Peter, who's going to talk about exactly what QDN does and who we are.
Okay, I'm Peter Gurr. I'm a Townsville local and used to be a business owner here in Townsville. I'm also a MS person diagnosed 6 years ago, so I had to close my business down and take it a little bit easy and try and get myself right, which is not going to happen unless some health people come up with a miracle. QDN, or Queenslanders with Disability Network, they are for people, by people, and run by everybody in QDN has got a disability or a family or partner member with a disability. So we're all in it together and we all know what each other's, not disability, but that we're all on the same level of communication and everything about our problems and everything else. Statewide, we have 1,500 members now. When I first started at QDN, we only had 800. So we've grown, nearly doubled. And it's our 15th year anniversary this year, so it's a bit of a big year and a bit of a milestone. We've got 12 staff, but that could be changed by today, who knows? They change staff pretty regularly because we've got casual staff and they move on and we get another casual staff person in to help us out with all sorts of stuff that we do. There's 7 people, as I said, on the board, and basically we're now around the state, plus a few in Brisbane. So, you know, like we're spread far and wide in the state. Our motto is nothing about us without us, and we work with each other and we try to change policy within government, the way they look at people with disability and how we go about that is up to Michelle, because she's at that system change. That's why we pay her the big bucks, I guess.
So I guess just to give a bit of an overview of the work of QDN, we are funded as an information referral service, and we're funded to undertake systemic policy to be the voice of people with disability, and that's across a range of policy areas, depending on what our members and our local support groups tell us about what's important to them. We also are funded at the moment to undertake quite a bit of work in the space of National Disability Insurance Scheme, the NDIS. I think an important part of the work of QDN is it's lives to the motto of nothing about us without us, and it's very much about a co-design, working that it's informed and led by people with lived experience. I think we've lost our technology, but that's all right. So I guess we wanted to talk to you about the work of the disability support organisations, which is where the local support groups fit. And to set the scene, in terms of disability, we're in the biggest moment of transformational change in the disability sector. We've got the rollout and implementation of the National Disability Insurance Scheme, which I think is a great example, and really, shows the power and the passion of people, and what can happen when people come together about something that's important to them, and to bring about that change. For the first time ever in the history of the disability sector, we saw people with disability, families and carers and service providers unite around a common vision that we needed to do things differently to deliver support and services to people with disability. And I think you would have all seen the evolution of the NDIS in that space. The NDIS gives people with disability choice and control, and it's a different way of operating and a different way of doing business. So in the wisdom of the National Disability Insurance Agency, they thought that it's really important that they start to build the capacity of people with disability and their families and carers to be ready for how that new scheme's going to work, and to be able to navigate, as we've heard, as a very complex system, and to be in a place of being empowered to do so. So the initiative that they funded, thank you, Julie, is the Disability Support Organisation, and that was to establish networks of people with disability or networks of families and carers to be able to connect each other and provide that support, information, and an opportunity to work out how they were going to prepare for the NDIS. Queensland we only got funding for one DSO, so that was Queenslanders with Disability Network. There's another 18 across the country, most of which are in Victoria and New South Wales. And just briefly, in terms of QDN's role as a DSO, we've had the job to establish 25 local support groups across the state. They're in various locations. We're going to talk to you today about Townsville, but we also have a local support group in Normanton. We also have one in Charters Towers, about to establish in Cairns, and then ranging across mainly the east part of the coast and in southeast Queensland. We had a request from our group members that there was to be some groups specifically for people with intellectual disability. They're led by people with intellectual disability, for people with intellectual disability, and we've also got a couple of virtual networks. And I guess there's some information up there just about the work that we do to provide support, training, and the things that all of our volunteer local support group conveners need to undertake the very complex job often of bringing together groups of people and sharing information and supporting each other. Peter, I'm going to hand over to you to talk about what a local support group is and what they do and how Townsville got started.
Okay, well, a local support group is like all local support groups that get started. They're usually about somebody that wants information or a group of people that wants information. In this case, it was people with disabilities coming together wanting information about the NDIS and how they were going to navigate that system. Now, everywhere we went, there was not enough information given on how we were actually going to do that. Some seminars we went to were very, very good, and we were able to find that information quite easily. Other organisations or seminars that we went to sort of counteracted that information that we just got from the last seminar. So it was very confusing for people with disabilities. So we had a product that was given to us by the government and by the NDIS straight from them. So it was we were able to sit there and think about how we were going to develop this and do it. So what we did here in Townsville was we sort of followed the same lines as what had happened in other cities in Brisbane and elsewhere in Queensland where it was already running. So we run them guidelines, but not every hat fits every head. So we had to adapt it for the Townsville area, even though the disabilities never changed. CPL doesn't change from here to Brisbane and everything else, nor does MS, nor does other things. But the people changed and their wants were different. It was rolling out in Townsville first, so the wants were information, and we want it right this very minute because we're going to roll out. And what we did was I went to my individual groups, and we had only 4 people that wanted to be in the local support group, and we thought, is this worth it? And then, okay, we will do it. We'll just try it. So we got together all of the city's leaders from around the area, and we said, we're going to have a meeting. QDN's going to come up here and have a meeting. And QDN came up, the staff, and myself as a board director, and we sat down in a room at the local PYC, and we talked to the city's leaders. And straight after that meeting, we told them what we were all about. And that, when I say the city's leaders, it was the city's mayor, the city's councillors, and other people that were right up the very top echelons of Townsville, plus the service providers. And we needed them to be in the room so that we could get their support as well, because they were the ones that had the participants that were going to be going into the NDIS and staying with them. And all we wanted to do was give them the information. We weren't trying to steal them. We just wanted to give them the information that they needed to be able to go on in a peer-led, I heard that before, peer-led setting. And it's amazing how well it worked. We only had, I think, in that first meeting, 8 people, and 4 of them, I think, were made up of staff from QDN. So there were only the 4 people that turned up. The next meeting, I think we still had 8, but there was 4 new ones with disabilities. And the third meeting, we slowly grew. I started going away a lot to Brisbane to do other work with the board and with QDN, that I decided that I was going to make a precedent here in Townsville. And I talked to QDN and said, we need to have co-conveners in all of these groups, and we need to bring other people along and nurture them along to give them a go at being the conveners and actually taking a more senior role in the groups, in a, like, you do it 1 month and then Johnny, you do it the next month, and have that turnover of people so that they all got to go and they all got a chance to be heard, and also to give their information that they thought was crucial to them that might be crucial to somebody else. So I got another a convener, which was Daniel. I brought him online, and it has worked out very well since that day, and we've been going a bit over a year and a half or something. So we started at a really good time where we were able to, we had 12 months before we were rolling in, and it was into the NDIS, and we were able to share a lot of information that people needed and wanted, and we were able to go back to the NDIS and the leaders like QDN to get the information from government on the needs and wants that we had in our local community. And our group grew to 25 in no time because of that. And then it grew further from there. So I'll hand it back to Michelle, and she can ask the next question of us both, I guess.
6 months or so of joining, Peter asked me to share the load. And I, at that stage, had spent some decade working in the disability sector in various different roles with facilitating different support groups, advocacy, working with different levels of government and so forth. So we looked at basically, I think when I came on board, we had about 7 or 8 months before we were expecting to roll out for the NDIS here in Townsville. And it was expected that the lion's share of the people in the room would transition fairly soon thereafter. So we broke down the task of how do we get ready and what do we need to know so that we get the most out of the scheme the first time around. Because we had heard many times from many sources that it's really quite important to get this right the first time because after all it is your life, and if you have to wait another 12 months then that's 12 months where things may not be as good as they could be. So we spent 6 or so months with Peter, mostly in Brisbane at times due to his other duties. Going through lots of planning around what does it take to have a good life and what does it take to actually be included and be a welcome and participating part of your local community. I think in terms of, actually I might leave it there and come back to that in a moment.
I think that's a nice segue too, because I think the group has been about supporting people at an individual level, but it's also been a great change agent at a community level and a systems level. And I think that's something else we wanted to share, of that impact that the power of people coming together can support at the individual level, but it also can have impact on changing community. We know that the NDIS is just an enabler in people's lives, and that the real issues that members talk to us about are how to get affordable and accessible housing, how do I get good health care that meets the needs of me as an individual, how do I access the community through transport that supports me. So these are all the things that people across the groups, across Queensland, we're talking about, that it's the interface issues with those mainstream services and how do we drive that change to get better outcomes for people. So Peter, do you want to talk about some of the community level work we've done?
At a community level here in Townsville, I'm also part of, through QDN, my work at QDN, I got offered a position with QCOS as an Emerging Voices speaker at different events, and QDN and QCOS got together and got to talking to the Townsville City Council and a few other leading organisations here in Townsville and government, and we got the NDIS involved, and we just had one yesterday and the day before it was the annual QCOS QDN NDIS Changing Lives, Changing Community Conference. Now, we had one 12 months ago, and I'm one of the organisers on both. And it was such a success the first time round that we decided that we'd do it again. So that's something that we did just as a trial thing 12 months ago that brought the entire community of people with disabilities, our carers, community leaders, everybody together, all to work as one for 2 days. And some of the information and some of the work that we've seen yesterday and the day before around systems change in government and change of thinking through people with disabilities and without was nothing but amazing, from a person that is a tradesman, a building contractor, still licensed in Queensland, and a business owner, and now a person with a disability. I am just sheer amazed at some of the things that I've seen in the last 2 days, and I've seen over the period of time with the DSO and different things that we've done here in Townsville. But we've also, Daniel and I, done a lot of conferences and other things that QDN has opened up to us, including this. You know, what we're doing today has only been available to us because we're of our association with QDN and the work that we do with those guys, and their knowledge and their commitment to us and to the community. So it's very important that all people with disabilities can access you by accessing us and getting your knowledge by being able to be here with us. And I'm privileged to be here.
Michelle, we have 10 more minutes, so if we could wrap it up, we could have some questions.
Thanks, Julie. I'm just going to hand it over to Daniel just to do, I guess, a bit of final information about, at that systems level, the role of the groups has been at that grassroots, what is happening on the ground, and that has informed lots of really big picture policy change. And I just asked Daniel to share a story about transport.
Well, I'd like to say that one of the wonderful things that we have seen is amazing personal growth in the group, but we've had some really positive systemic changes. A couple of very quick ones I think of was there was an individual whose equipment had been cut off, and that potentially, due to that person's condition, could have had extremely dire health impacts, and due to the work that Peter and I were able to do, and with the assistance of QDN in Brisbane and interface with the agency here in Townsville, the NDIA, who administrate the NDIS, we were able to see that situation rectified very rapidly. Also with CAPS, which is the Continence Aid's subsidy program or something to that effect. Sorry, my brain's gone out the window momentarily. With the rollout of the NDIS here in Townsville, many people who were in receipt of that Medicare funded system were told that they were going to have to wait possibly up to 6 months while they roll out on the NDIS, because that had already been cashed out into the new program, and many people couldn't wait. And so again, we were able to feed that back into the system, and people received those payments on time or almost on time to tide them over until they were moved into the NDIS. So finally, the probably big systemic change that we've been working on now for many months and unfortunately yet to get quite the outcome we'd like is, and indeed need for very many people in Queensland, is that of transport and the taxi subsidy scheme, the TSS. In Queensland, when people move on to the NDIS currently, they are removed from the TSS program, and so they lose their half-price taxi card. And unfortunately, as the system exists currently, they're not in any way adequately compensated in their NDIS plan for that, which is having some rather dire effects in terms of people's ability to access their local communities. But we've been able to use an absolutely essential service for anyone to be able to access their own community, absolutely. So we've been able to use our links with QDN and the NDIS and various different levels of government to work through this issue. And we are still in communication with various levels of government at present to come up with both a short-term solution and a permanent one. But watch this space on that one. We won't let it go quietly.
And I think we're probably all a little bit hungry, but also wanting to hear more from our speakers. So maybe we could throw over to questions and use that as a way to finish the session. Is that okay, Michelle?
Yeah, just as we were doing that, I was just going to say, and I think Daniel and Peter were probably being very modest in terms of the power and the passion of the group around the taxi subsidy, because the Minister actually has come to meet with the group several times, Minister O'Rourke, to get that first-hand experience about what is happening on the ground for people with disability around the TSS and informing government in that way. And I think that's a great example of, you know, the strength of the groups across the state to provide that lived experience to inform good decisions at a government level.
Sorry, I'm not sure that this one's working, so I'm going to have to run around with this. So we have a question here.
I do have a question, if any one of you can answer. As you were saying before, you are catered to all disabilities, no matter what disability they are. Okay. I am hearing impaired. How well are people with a hearing loss catered for with ENDers? For example, I might come to a place like this and I can't afford captioning. Does ENDers provide captioning?
So that was a question about captioning for people with hearing impairment. Who would like? Peter?
We do, and yesterday and the day before, QDN and the National Disability Insurance Scheme are not sure on them themselves, but I do know that we do at QDN, and we also, for people with vision impairment, we use a lot of sign and whatever they need as well.
And Shirley, maybe we can have a talk to you later about who to talk to in the agency, because we're not the National Disability Insurance Agency, unfortunately, but we can find out that answer to that question.
That's right. We have one question down the back who we haven't heard from before, and then I'll come to you, Kevin.
I'm a care partner of someone who has younger onset dementia and very strong advocate, as he is as well.
Should be right.
I'm a care partner of someone who has younger onset dementia, and he's a very strong advocate as well. What I was going to say is we still actually feel very isolated, and I didn't know anything about the fact that your group existed. We don't actually, we're from Brisbane, but our connections seem to be more national with Alzheimer's Australia, and a lot of people don't even realise with dementia whether or not we fit into the disability area. I feel as if what we're trying to do is reinventing the wheel, and I just wonder if somehow we can link up a little bit better, because I organise a support group and people are asking me for the information. John's just going to miss out on the NDIS because of his age. But, you know, there's so many people out there who are still not getting any help.
I will hurry up to the front.
Yeah, more than happy to connect and talk to you at lunchtime. And I think there are lots of wonderful things happening in the community, lots of great peer support groups and peer networks, and I think it is about how do we work more effectively together, recognising that different groups have different purposes and different needs and visions, but I think there's great work that we can do collectively to strengthen that.
Daniel, did you want to say something? No? Okay, sorry.
Hi, just a quick one. I've been hearing a few stories of late about younger people with disabilities in aged care homes who are getting kicked out of the aged care home, and there's even one just down the road from QDN at Lutwich who are doing that, and they're being moved into state housing, which is not even disabled access. Because NDIS won't be coming on board until 2019, has QDN had any thoughts? I haven't seen anything on my emails come through for a while. Has QDN had any thoughts on how to deal with those people?
Just quickly, because I know I'm holding everybody between here and lunch, QDN's been a very strong advocate throughout the whole of the implementation process about how do we make sure that those people who are vulnerable don't miss out on the NDIS, young and people with different needs, whether they're homeless or at risk of homelessness, exiting the criminal justice system, child safety, young people in nursing homes. So the NDIA have the Department of Social Services have just funded 4 organisations in Queensland. QDN's one of them, to work in the southeast corner with people who are disadvantaged, experience additional disadvantage to accessing the NDIS. So we have started some conversations around young people in nursing homes. It is to work with people who are homeless, at risk of homelessness, and all those other additional disadvantages that people experience. There are 2 organisations who work in far north Queensland to work with Aboriginal and Torres Strait Islander communities around supporting people and community to access the NDIS if that's what they want, and also Amparo for culturally and linguistically diverse backgrounds.
Oh, we have one final question. If you can keep it very quick, because everyone wants to go on lunch, I'm presuming, and I don't want to hold it up, and we've got to prepare for the Minister. So,
Hi, I did have 2 questions. One's really quick. Are you coming to Rockhampton? Secondly, where do you see the carers allowance and carers payment moving forward with NDIS rollout?
So I'm not sure if QDN can speak to the latter, because that's a big policy issue which they're not responsible for, but they can certainly speak to the former question.
Under the NDIS, I had to find this out myself because I'm a participant under the NDIS. My wife is on the full carers payment. Now, under the NDIS, it doesn't affect your carers payment. That's what we were told by Centrelink, and that's what we were told by the NDIS. Now, it is my payment for my care and my life. It is not my wife's. It is for me to get the care when my wife's not around, not my wife. So if you've got to understand that it's the individual's package, not anybody else's. and it only affects the individual for their entire life. That's another thing that people don't understand. Get it right first time, because it's for your entire life.
I think, as you can tell from the questions, the NDIS is hugely complex. So please join me in thanking our wonderful speakers for shedding some light on that. And also congratulate them for the great job they've done in setting up a really meaningful local support group that's making real change. So thank you very much for that work.